Joining me now is CBS News correspondent David Begnaud. He's in Pittsburgh with an emergency room doctor. David, what have you been learning?
Well, Elaine, I was at that press conference and I heard that gentleman speaking, and other officials there also talked about the heroic actions of the responding police officers and the good work of the doctors, the incredible work of the doctors who work to save the lives of the patients who have been brought to the hospital. So we came here to UMPC Presbyterian. We, in fact, are in Trauma Bay 3 is what they call it. There was actually a patient in this bed roughly 24 hours ago in this room being treated. And I want to bring in Dr. Alexandra Castro. She is one of the attending emergency room physicians who was activated when the call came in. You knew that there was a mass shooting. And the synagogue is how far from here?
Less than 10 minutes.
Less than 10. How many patients arrived here?
So we got 4 patients as trauma patients, and then we got another individual who came in as a regular patient that was also at the scene.
So you had police officers who were being treated here. You had people who were inside praying when they were shot. What is something you remember from treating those patients that you'll never forget?
I think that the most meaningful event, or what I will take out of this, is the teamwork that we had here at this hospital, the number of physicians that we were able to gather in such a short amount of notice and time.
How many?
So we had 9 trauma surgeons that ended up coming in, trauma surgery. There were specialty surgeons like vascular surgery, orthopedic surgery, etc., that came in as well, and residents from all over the hospital, all the surgical residents, medicine residents, all came down with willing hands to help.
I've heard doctors say, you're not going to die on my watch, right? And I know you grew up here. This is home for you. Is there something you said to the patients to comfort them?
So, I mean, I have to say that, as an emergency physician, sometimes we don't get a lot of time with our patients because it's our job to make sure that, they're hemodynamically stable, they're breathing, etc. And I didn't really get to talk to many of the patients. They were not in the emergency room for that long. As soon as they came in, we quickly made a decision for their disposition if they were going to the operating room. So I think, that the fact that of actually talking to the people, we didn't really get to talk to them that much.
You had about 5 minutes or so with each of them, right? Before you moved them in or out. Nobody died here, correct?
No, we did not have anybody die here. All of the people that came here are, stabilized. Some are in critical condition. But yes, everybody that came to the emergency room was, if they were critically ill, taken, to the operating room immediately. But nobody died.
Dr. Castro, thank you for your time.
You're
Thank you for your good work.
Thank you.
We appreciate it. Elaine, back to you.
All right, David, so compelling to hear what it was like for emergency officials trying to deal with that tragedy on Saturday. David Begnaud, thank you so much.